Hey, hi.
Um, I just want to start by saying thank you on behalf of the University of Arkansas and the text program for giving us your time today to talk about what we're going to talk about.
Of course.
To start off, could you just tell me when and where you were born?
Sure. First of all, thank you for having me here, and thank you for coming here and learning more about Tibetan culture. I was born in India, in Dharamsala, and I was raised here. I did my education here until I moved to the US for my further study.
Do you have brothers and sisters?
Yeah, I have a sister.
So when in Dharamsala you were born in a refugee
Right, yeah.
for Tibetans. Were your parents born in Tibet?
Yeah, both of them. They were fairly young when they escaped into India. And yeah, presumably they met somewhere in India, somewhere in Dharamsala. And yeah, and so I was born there in a very, it used to be, Dharamsala used to be so different then as compared to now. And there's a small handicraft center, Tibetan handicraft center. And that's the place where most of the refugees, especially women, when they first get to Dharamsala, they get a chance to work there and find a new home for themselves. And I was born in one of those tiny little room up there.
That's awesome. Could you elaborate about their escape? Did they tell you anything about going from Tibet to India, either of them?
I actually have heard very little about their journey to India and what they need to go through at that time. And because when I was only 6 years old or 5, I think I was sent to a army or military boarding school, and I was in that school for almost 13 years, so I really didn't get much chance to talk to them. But one thing that I know is my mom's father, my grandfather, he used to be a hermit, and so she would always tell me when they first get a chance to come to Dharamsala, my grandfather found out that there is a place on the way up to Triunt. So any non-Tibetans who comes to Dharamsala would know about that place because it's such a nice hiking place. And so my grandfather was able to find a small place on the way up to the mountain, and he spent time during the last 2 or 3 years of his life as a hermit. And so that's one thing she would always tell me, how she would go up, climb the mountain with some food, and how her father would meditate up there all through the year. And so that's the thing that they would tell me.
That's incredible. Do you remember, did your parents ever tell you what they did when they lived in Tibet, or what their families did?
Actually, I haven't heard much about what they were really young when they escaped into India. But other than they telling me that they are from Kham region. So Kham is more in the eastern side of Tibet, where basically shares a border with China in those days. So that's the place where they were from. My dad and mom were from the same province, but from the different region. And so Kham in Tibetan, in some way, is known for being a warrior, and they basically have a different outlook about their life. And so they would tell me a little bit about how, as a Kham, one is expected to lead their life very adventurously and kind of a go-getter. So when I remember when I decided to leave Dharamsala, I was working at Tibetan Medical Institute. It's called Menzi Kang. I did my medical education over there, and I was working there. And eventually, when I decided to leave everything and go to the US for my further study, I was thinking about what especially my mom would tell me, like, you should just go out and do it. And so that's a kind of a little bit of a calm nature that sprang up.
Are they still alive?
My mom passed away just recently, 3-4 months ago. My dad died in 2007. So that's why I didn't really get much chance to actually spend time with them and ask about their life in Tibet or in early years in India. So yeah, both of them must be somewhere around.
Did they live in India?
Yeah, they whole their life they lived in India since they escaped into India. Yeah.
So you went to the military boarding school when you were 6, after being in the refugee camp. When did you go to the States?
Not too long ago, actually. In 2009 January, yeah, I went over there. So it has been almost now 7 years, I think, right? 8 years running, yeah, since I moved there.
Can you tell me about, so the Dalai Lama placed a lot of importance on education, like quite early on during the, like right after 59.
Exactly, yeah.
Can you tell me about some of your early school years when you were in the refugee camp?
Yeah, I think I didn't really have much recollection about how and why I was sent to the military school, other than my dad being in army at that time. And that school was specially made for families who have one of their family members in Tibetan army. So Tibetan army is under the umbrella of Indian army. And when I was sent to the military school, it was basically more about, again, finding another home, because for most of the Tibetans, we kind of, it's hard for us to say that this is my home. We're constantly moving, so it's more like a nomad. And so for me, going to the military school and be there for another 12, 13 years was basically really kind of finding a new home. But I think it was really when I got into high school that I realized that I really need to do something. And I remember thinking about going to a med school and really trying to find resources to go to the medical school and study Western medicine. And around that time, it was really hard to get into a med school financially and everything. So I ended up going to the Tibetan medical school to study Tibetan medicine.
In the Tibetan medical school, well, hold on, sorry. What year were you born?
74, so I was born in 1974.
Can you tell me about the Tibetan medical school, where it was, and what, like, just day in the life?
Oh, yeah. So in Tibetan it's called Menzikang. So Menzikang literally means men means medicine, Thi astrology, and house. So it's a Tibetan institution of medicine and astrology. And so one of the things that Tibetan Medical Institute or Astrological Institute has been able to do for Tibetan refugee community is not only preserving Tibetan culture, but also providing a platform where Tibetan youngsters can come and study without really paying anything, because it's been all funded by His Holiness's office. And how it is does is, like, through the private office they would find a scholarship for each students or sponsor for each students. And I remember when I really had a tough time not being able to go to a medical school to study Western medicine due to financial constriction, I was told that if I am able to get into the Tibetan medical school, I don't need to pay anything. So of course we all need to get through the entrance exam, which was really tough at that time. And at the Menzikang, it's a 6 years program, and once getting in is really hard, like most of the other medical schools. But once you are in, you kind of very quickly get incultured into the ways that students are being trained, and it's very seldom that any students would be dropped out, because you get carried away by everything happening around you. And so at the Menzikang, everything is being taught in Tibetan, so one has to be not very good, but one has to be good enough to read and write Tibetan language and Tibetan grammar and stuff. So that was one of the challenges that I had when I first went to the Tibetan medical school, to really have a good command over Tibetan language, written and spoken. So that's, yeah, and once we're done with the 6 years of training, then we'll be sent to any of the other branch clinics that Menzikang or the Tibetan Medical Institute would have. Yeah.
That is so fascinating. So, have you gotten to experience Western medicine since you've been in the States, like shadowing doctors? Or?
Yeah, even when I was in medical school at Menzikang, we would constantly have doctors or the healthcare providers from different disciplines coming to our institute and talking to us. And one of the things that someone like Dalai Lama has always stressed at our institution was to be more inclusive rather than exclusive. So there's this constant interaction with other healthcare providers from different disciplines. And I remember when I was at school and in medical school, psychiatry or the mental health was one of my kind of favorite topics, and I got a chance to work with some other psychiatrists and psychologists from the US. At that time, they were really experienced people who came to our institution, and so that was kind of my introduction to the Western modern medicine focused on mental health. And then while practicing, it's inevitable that for our Tibetan doctors to have certain knowledge about the Western medicine, because most of the patients who will come to see us, usually they would come when they have tried everything. Once any Tibetan doctor start practicing, it's inevitable that to have certain amount of knowledge about Western medicine, and so that's how we have to teach ourselves about the Western medicine. And then moving to the US, I ended up doing my undergrad and everything all over again because I didn't get any credit transfer. So I remember taking all those freshman and sophomore, junior courses over there. And in a way, it really took much longer for me to get into the PhD program, but it really helped me to study and get exposed to something which I was interested about before I went to the Tibetan medical school. So I got a chance to study a lot of stuff that I'm really interested about, including the Western science and medicine. So that's how it really helped me to kind of have that integration of the Tibetan and Western medicine.
The group wants to know, how did you get involved in the Emory program initially?
Well, it just kind of happened by default, because when I got done with my undergrad at the University of Minnesota, I got into a public health program, and my whole purpose of going to the US was to be trained in a Western kind of to be trained as a Western researcher or a scientific researcher, and I really wanted to go into the School of Public Health and study about the scientific research method. In any case, once I got into this public health program, I realized very quickly that the tools that I was learning at that time might not really help much for me to study Tibetan medicine, because medical system like Tibetan medicine or Buddhist philosophy in a way is very much leaning toward metaphysical aspects and something that is not necessarily observable or measurable. So, and then I started kind of going around to other schools to look for medical anthropology courses. So Emory was one of the schools that I went to, including many other schools that summer. That was in 2012. And I had no clue about the Emory Tibet program. And when I went to Emory to visit the campus and talk to people, I started to hear about the Emory Tibet program. And it didn't really kind of, I didn't get any kind of association with the Emory Tibet program at that time. But my second year of Emory, my graduate program, they need someone as a TA for the science course here at the Drepung. That was in 2014. And one of my favorite professors were coming here to teach neuroscience. And I jumped on that opportunity and I said, can I please come with you and be a TA? And as they say, rest was the history. And then I was here in 2014, I just loved it. And then I decided to do my field research here, and that kind of reinforced the connection that I started to have with Emory Tibet program.
It's incredible. I kind of want to know what you saw differently in Tibetan medicine because of Buddhism as opposed to Western medicine. I feel like there's a lot.
Yeah, I think, we certainly, in terms of, there are not only differences, but also there are lots of overlapping, right? There are lots of similarities. But in terms of differences, one core difference that we can talk about is always the the way of diagnosing any kind of illnesses or diseases. Because in Tibetan medicine, sometimes the people feel like why you want to complicate something which could be very simple, right? You can just run a test and make a diagnosis and design a treatment. But in the context of Tibetan medicine, it gets a little deeper. The immediate problem, for instance, like any kind of acute problem, infectious illnesses or chronic problem, you very quickly make a correlation between one or other causes. But in Tibetan medicine, we say that those causes are immediate causes, but we need to look at the distant cause, which in a way is your mind. But mind also can be ignorant mind or knowledgeable mind. So in Tibetan medicine, we're looking at an ignorant mind, where people tend to engage in different behavior based on body, mind, and speech interaction. And those behavior actually can really lead to certain imbalances that can manifest over the period of time pathologically as an illness or disorder. So that's a very core difference, because by focusing on the root cause, it kind of help the physician or the caregiver as well as the patient, because you are giving an agency to the patient. Patient is not just something to work on, but patient is an equal partnership in that process of healing. So that's, I think, is really important, because you are making them one of the stakeholders. They are not just a noun. They are not just a number. So that's really a core difference, which I really feel that could be very aptly used in today's healthcare system. One other thing, really, again, is really once then you go through the diagnosis, then it's what kind of treatment you want to design. And I think it's really important in terms of many of the traditional medical systems, but in the context of Tibetan medicine, there's so much focus on a diet and a behavior and how you actually can change and remodify or modify the diet and behavior system, rather than just kind of starting with, like for instance, mental health issue, which really I hold close to my heart, because in Tibetan medicine there's always this emphasis on body-mind relationship, and mental health in Tibetan medicine is very rarely talked about, because we don't really have any specific term used in Tibetan medical practice, either depression or anxiety or schizophrenia or anything. We really understand that as one form of imbalance in your body. So in the Western medicine, the problem, I think, not problem, but limitation that we can see is those understood as certain deranged level of chemical in your brain, and then you are very quickly prescribed some kind of medication or chemicals that kind of addresses those deranged chemical in our body, in our brain. And I think it very quickly, we would realize it very quickly that it doesn't really, it might fix one problem, but it might cause number of other problems. And that's why I think the key difference is in terms of both the diagnosis and the treatment. The fundamental principle itself is very different. You first you want to look at the root cause, not at the immediate cause. The second, when you design a treatment, you want to focus on changing your lifestyle, changing your diet, rather than just quickly prescribing a medicine or any other intervention that could just work right away. So I think those are the differences, besides many other differences that we can talk about. Yeah.
Could you give me an example of someone coming in with whether it's a mental health problem or a physical ailment, what you would do as a doctor to like diagnose and treat? Just a specific example.
Yeah, I mean, again, I think since I started with the mental health in terms of differences in when we look at the designing a treatment for a person, I remember a particular case when I was in the States. I know a person who is a good friend of mine, and she had some issue during her winter break before you would go into the spring semester. And she had a very minor surgery, and she was looking forward to graduate coming summer, so she don't want to be like, having any kind of a problem during the winter break and not being able to come back for the spring semester and not being able to graduate. So she had a very minor surgery, and things didn't really work as she and her family planned at that time, and she was getting a little anxious about it. And so therefore she could not really sleep that well, and she was getting a little irritable. And unfortunately, the family physician or the person that she sought help at that time very quickly prescribed a medicine, and that medicine created some other complication.
Which medicine?
Anyway, she didn't tell me which medicine, but any kind of antidepressant pills. And so she was having a severe constipation. She cannot eat at all. She cannot sleep. Then she get a medicine to sleep better, and then by taking that medicine to sleep better, she gets her constipation exacerbated. So eventually, her mother called me, and the first thing, I was really surprised when she told me that her daughter is in a psychiatric ward, and I was like, why she's in a psychiatric ward? Because I met her a few weeks ago, and she was doing absolutely fine. And so she quickly told me a little bit about her stories, and I said, like, see, the first thing we need to do is get her out of that place. And she need more support from her family and her friends than anyone else, or from me or any other doctor, because that's the time when the person will need support from their family members, from friends. So they got out of the psychiatric ward. What I did at the time was, so we didn't meet in a clinical setting or anywhere else. We just say, okay, let's have a lunch. So I met with her mother and herself, and so as a Tibetan doctor, as I said before, the important thing is really looking at whether we should look at the distant cause or the immediate cause. So what's her problem? And so for me, it was really identifying the immediate cause that might have led to that problem. So that was her anxiousness to get back to school. But then I wanted to know, is there any other thing behind the curtain? Like, is there any? So it helped us, especially for me and also for my friend, to know that she has some other underlying issues that she was not dealing at that time, trying to deal with that time. So that's a way really kind of for determining what's the real cause, and is there any immediate cause? You need to solve that, but there's a bigger issue out there. And we were able to also modify her diet and lifestyle and change her environment. And those things are really important, not necessarily having any kind of particular drugs or a medication. And she's in a grad school. She finished her school in nursing. She was in a nursing school, and she graduated. She's in a grad school. And I think these are the things that we can very easily kind of reframe the way we look at the causative factors and the way you design a treatment. So I think it's a very simple example, because I think for us it's so important, I mean, parents as well as the patients and for the caregivers or the physician, to know that what we see is not necessarily what you think it is. There could be a lot of things happening behind the curtain, and you need to unwrap that in order to, even before making any diagnosis and then trying to design a treatment. So I think in that sense it really works. Yeah, it really works that way.
That's really fascinating. So you're doing research over death and dying in Tibetan culture?
Yeah, so basically Tibetan culture, yeah.
Can you expand on what exactly you're looking at, or you're looking for, or just? So
broadly, I'm looking at how in Tibetan cultural context, focusing on Tibetan medicine and Buddhist philosophy, how Tibetan doctors and monks and nuns provide care for a dying person. So it's really, it sounds so much like end of life care, but at the same time, it's not just only the end of life care, but it's also really about how a physician, a Tibetan doctor, and a Buddhist practitioner works with the family members and how they collaborate with each other. And as I said before, trying to give them an ownership, trying to give the family members, the people who are dying, an ownership that they deserve in terms of making a decision about one of the most vulnerable times of their life, when they might think that they don't have much time to live, and or due to many other reasons, financially, complete debilitating state of their health. And at that time, how Tibetan medicine practitioner and the Tibetan Buddhist practitioner understand each other's role. And so I'm looking at how that particular collaboration provide a care for a dying person.
What I've seen in my rotations for someone who's dying, there's a very almost painful sense of finality because of just Christian culture in America. So what do you see that's different in a Buddhist means of grieving for someone who's dying?
This is very important and interesting question, because if any people are kind of familiar with the recent scholarship about death and dying, one of the most common conversations that's coming up is really about the way caregivers or people conceive death and dying, and how that particular conception impacts the care and assistance that has been given to a dying person, right? Because in so many ways the values and beliefs that we have, like as you said, like in a Christian culture, there's a certain way of conceiving death and dying, right? In the same way, in Tibetan Buddhist culture, there's a way of looking at death. There's a way of not only just understanding or having some sense of conceiving death and dying, but also how you apply that to your life, right? I mean, in so many ways that we have some theoretical understanding, but it's so hard to apply that in our day-to-day life. And I think in a particular culture setting, like for instance, like this one, it's one of the largest Tibetan settlements, refugee settlements. At the same time, it also houses two of the largest Tibetan monastic university. And to have this kind of a cultural setting, it is in some way easier for people in this kind of a cultural setting to apply their values and beliefs. And so that's why I think in Tibetan cultural context, especially related with my research, it's fascinating to see how they actually conceive death and dying, what's their feelings, what's their experiences when they talk about death and dying. And even in the context of having this kind of a Tibetan cultural worldviews, there are lots of differences also. There are differences in terms of how the Buddhist monk or nuns would conceive death and dying as compared to the Tibetan doctors and lay people. And then that also very much impact their way of taking care of the dying person, their way of designing a treatment for their family members or for the patients. So I think that's a huge difference in terms of the conception of death and dying and how it's applied. But for instance, like if I can just say a few words about like how Buddhist monks' perception of death and dying would be different from Tibetan doctors itself. Even though Tibetan doctors are supposed to know the Buddhist interpretation of death and dying, but they look at it from a very different angle. So when I talk to some of the Tibetan doctors, they would say, we need to understand the inherent constitutional nature of the patient. So if the person is like in the West, we have personality A and B and C type. But the Tibetan doctors, for the Tibetan medicine, we would have Lung, Tiba, Pekin constitutional nature based on elemental predominant nature. If some person is generally a little more aggressive in nature, a little more irritable in nature, during the time of death, they would act and behave in a very specific manner. They would be stubborn and they want to do things their own way. And having that understanding really give a little bit of more space and time for the doctors to act and design a treatment for them. But then when I speak to the Tibetan monks, their way of looking at death and dying is quite different. The way of caring, providing care for the dying person, because they would say that there's a 3 different ways of dying. And those 3 ways are, One is dying with fear but no regrets. The second is dying without fear as well as no regrets, right? Now the third one is the much higher level, and they would say that dying joyfully. You understand, and for these people, practitioners, death is basically really an opportunity for them to spiritually develop further. And so for them, that particular moment is really a joyful experience, and they kind of look forward to that. So having that kind of a nature of understanding for the Buddhist practitioners, they attend to a dying person very differently. They need to know if someone is scared but without any regret, then they have to deal with them differently as compared to someone who is very joyfully, they're calm and they're relaxed and they are kind of glowing even in the face of death. Then they don't necessarily really have to do much. So in the same way, the Tibetan doctors also, like if I attend to a dying person, based on their constitutional nature, their personality, I need to act differently. So I think that's a very, it's much more profound than I actually anticipated coming here out in the field.
I know that in the States we have hospice, so like we try to make it like a homey environment, and the family comes in, and the doctors will give them like pain medication and make sure that they're comfortable and that they don't get like a cold or something. What is it like for your care for dying patients?
So, and this also I think is a very important thing to kind of look at the way dying persons are given care at hospice has changed over the period of time since it started to kind of flourish in the UK as well as in the US, and having a chance to see that environment in the US or in Europe, and then finding the way people are dying here in this cultural setting is interesting, because very few people here would actually ask for any kind of intervention to relieve their pain. And it's not that many people would die without pain and kind of smile and go away. I mean, I've seen people laboring through the trajectory of dying. And one interesting thing related with this is, like, in terms of determining whether someone had a good or a bad death, which is also one of the most common kind of conversations that's coming up in today's time related to death and dying. And I would always ask the people here, for you, what is a good death? Is good death is something that is without pain and anxiety and suffering, worse, and vice versa, right? And most of the time they would talk about, like, it would be much more comfortable to die without pain and being anxious about it, but that's not the factor that would determine whether it's a good or bad death. So I think also in a kind of a hospice setting here, where dying persons are assisted in dying peacefully and calmly, I don't necessarily see them being put on a pain medication or providing any sort of intervention to have a complete palliative care. So I think that's one difference. But also I think for any person to be mindful at the time of death, because in Tibetan Buddhist culture, just like any other culture, I think it always helps to be mindful at the time of death, because so that you don't have all those unnecessary thoughts in your mind. But then having less pain will certainly help to be more mindful, right? So I think that's one thing I constantly, when I observe or sit next to someone dying, I really try to ask them, and I always make a note of what kind of a different pain medications we have here in Monkor, because different region in India or in the world would have a different pain medication that they would prescribe. So I would have them ready. But until now, no one has actually asked me that, because I would give them an option, like, if you really want to help the person to die without pain or reduce the pain, we have this different kind of a medication, either IV or given through injection. So no one has really asked for that thing. So it seems like, yeah, pain is not something desirable, but that doesn't make any difference in terms of how peacefully they can kind of die or let other die.
So do they like ask for like their family to be there? Do they ask to be in their home? Like, do they ask for a setting, or do they ask for a certain treatment that you can provide?
So it's again, interestingly, one of the most common things that they would ask for is a picture of their root Lama or a teacher, right, spiritual teacher, and almost all the time it's always a portrait of His Holiness, and so that they will make sure that the portrait faces the dying person, and so it's really, I mean, that's one way of making sure that you are not thinking about all other bad things like grudges and plus and minus things that you have in your life. And so you have a single pointed kind of a concentration on your root teacher, spiritual teacher, which most of the cases is always a picture of His Holiness. The second thing they would ask for, and then they would always play in a small stereo player or a music player, a teaching of His Holiness. So it's kind of like, as you would know that the first thing that will go sensory from the sensory faculty is sight, when someone is dying, in the process of dying. But sense of hearing really remains for a long time, and so they would make sure that they play the teaching of His Holiness. And then the other thing they will always ask for is a blessed pill. So it's not necessarily any kind of a medicine, but it's some kind of a blessed pill which has one or other herbs and plants, but they give it more. Sometimes I wonder is more for the caregivers and family members rather than the dying person himself or herself. And so they would give the blessed pill. So those are some really important elements that they make sure that it's around when someone is close to dying. And when those things are being prepared, the patient or a dying person would have some sense of where they are getting into. You have pictures, you have His Holiness's teachings, and you have blessed pills around, and it's a time for you to be at peace and calm. Yeah.
That's
yeah.
fascinating.
I know.
That's really cool. It's so different than from like what we do in the States.
Yeah, it's
really cool. So the group wanted to know, how do you treat a monk, like a Buddhist monk, differently than you would treat your everyday Tibetan?
This is really important question. I mean, like I got this all the time, and I think being here at the Drepung Monastery for last 10 months has really given me more opportunity to kind of look at that question, because earlier during my practice I would always see some Buddhist practitioners, monks or nuns, along with other lay people, but during the last 8-9 months majority of the people that I would see are monks or nuns. And one key difference that I would always find is in terms of kind of helping them to understand their health, what could be the things that's causing them a problem, because as I said before, Tibetan medicine in some way is very related with Buddhist philosophy. When we talk about the distant or the immediate cause, we are all very much talking about the Buddhist philosophical approach toward relative and ultimate truth, so to speak. So when we talk about the ultimate truth, we are really talking about the fact that there is no intrinsic self. And in the Tibetan medicine, we always say that the root cause of everything is a false belief, false view. And what's the false view? False view is a view that there is an intrinsic self. And by having that attitude, you put extra emphasis on I and the egotistic feeling. And that can lead to certain mental emotions, i.e. attachment, desire, aggression, close-mindedness thing. And that's the state of consciousness which almost all of us tend to have other than at the level at which we might have those emotions. And once we have those emotions, afflictive emotions, which is being procreated through our stress on I, that's the time when we make ourselves very vulnerable, right? If I have more desire, attachment, or aggression, there's always a chance that I might produce any of the stress hormone in my body more than others, so I might release more cortisol all the time, and over the period of time I might make myself super sensitive to any kind of autoimmune disorder or being hypertensive. So kind of helping monks or nuns to understand that underlying principles of Tibetan medicine is so much easier because they have already studied them and they are familiar with those things. And once a person would have that, then again, as I said before, they become an equal partner in terms of, so it's not just that I'm prescribing some pills for them and asking them to follow certain diet recommendation, but they also take in charge of how they want the healings to be, whether to speed them up or have to no effect. So it's very, I think that it helps a lot to have that kind of a background for any kind of a patient, and especially with a Buddhist practitioner, it's really helpful.
Interesting. So how many people do you treat, or do you have like a client list?
You mean over here? Here, so I usually only do 3 to 4 hours of consultation, so it's a morning session every Wednesday. Typically it would be much better if I have only 10 to 14 patients coming, because then I can spend more time with them, but it's from 9 to 11:30, but I always end up being in the clinic until 1:30 or 2, so we would see generally 30 to 35 patients in the morning. And but I remember when I was working as a full-fledged doctor at the Menzikan clinics, we would see in a day 80 to 90 or 100 patients a day. So I think it's really, the first consultation is very important because you need to kind of walk the person through what are the things that they need to be careful about. But I think the follow-up consultation takes a lot less time, so you can see more patients here.
And then what ailments do you normally see in these people?
Here in India, it's always, most of the people would come with some kind of terminal illnesses or chronic illnesses, because those are the health issues or health conditions which the modern biomedicine doesn't necessarily, they certainly can be helpful in terms of managing those illnesses, but quite often they don't show much of a good positive response. So they would come to us. So most of them are diabetes, cancer, asthma, chronic arthritis or rheumatoid arthritis, chronic skin problem. So those things are very common. But interestingly, whenever we travel, or whenever I travel abroad, before I moved to the US, when I traveled as a Tibetan doctor, in the West, I always would see too many of patients with mental illnesses. And so it's really like, whenever we go, whenever I would travel around Europe, I have to make sure that the consultation time would be a lot longer than the usual consultation, because then it will involve lots of counseling and kind of a talking back and forth and trying to get to a point where the person would understand that what's the best option of treatment for the person. So yeah, mental health, a lot of those things in the West, but in India, very much a chronic lifestyle related health issue.
Have you ever thought about being a counselor?
I haven't thought about it, but there wasn't any option or a choice, because by default we became a counselor. And so when we because also in Tibetan medicine there is no specialization, so any Tibetan doctor is supposed to be able to address any kind of health issues. So we don't have orthopedic or dermatologist or anything. We have to cater to any kind of health conditions. But in terms of, as I said before, during the initial consultation, it involves lots of back and forth conversation, and so in so many ways the counseling comes comes in practice.
That's what it seems like when you're talking about how you sit down and talk to the patient
Exactly.
about what they want to do. It sounds very much like a
Yeah.
psychologist.
Yeah, it's very much. Yeah, it's very much.
So I'm going to go back to talking a little bit about Tibet and China, if that's all right. So you're married?
Yeah, I was. Yeah,
You were? Okay.
Yeah.
And you have children?
one.
One child.
I have a son.
Okay. And
Yeah.
are you raising him to be Buddhist? And
It's, I mean, the kind of environment that he is in, he get exposed to lots of Buddhist cultural related activities and stuff. So, I mean, among culture, I mean, even when I was growing up, until I really started to practice Tibetan medicine, I really have no clue. When people would ask me, are you Buddhist? I wasn't really sure if I'm a Buddhist or not. So for my son also, I think, I mean, we would never tell him that you have to be Buddhist. But I think the certain values and beliefs that comes along with being brought up in a particular cultural setting, you don't have to label that person as a Buddhist or non-Buddhist, but you embody visual embodiment of those beliefs and values. In a way, makes you much more Buddhist than any other who would just say some prayers and mantras, right? So without really getting embodied with those values and beliefs. So yeah, I certainly believe that he has those cultural values and beliefs in
are
it.
you teaching him about Tibetan culture? And
Oh yeah. Those certainly. I mean, every time we have a Skype meeting, call or a discussion about his papers. I mean, he, in some ways, he has a kind of a vintage point in terms of he has to write a paper. He can bring in kind of a Buddhist notion of looking at a particular situation, and so which in some ways work for his advantage because most of his classmates, his friends, they have to write about a particular topic, but they might not have a optional lens that they can use in order to write the paper. So we always kind of brainstorm about how he can bring in Buddhist cultural aspect in his essays or in his paper, and by doing so he get really exposed to those cultural things. Yeah.
do you teach him how to speak Tibetan?
I don't teach, but he speaks Tibetan fluently because I mean he was 6 or 7 when he moved to the US. And but again, I mean, like in the U.S., it has become quite common for many young Tibetans not being able to speak Tibetan or understand Tibetan, which is quite unfortunate. So every time, like when I talk to him over the phone, and if I ask something or tell him something, he would, whenever he used 1 or 2 English words, I would tell him to, could you say that again? And then he knows that he need to tell me and answer me in Tibetan. So those things I kind of, without really telling him that you need to focus on his native language, I try to make him feel like at least with me, because with his friends and classmates, or the moment he gets out of the house, he can't speak Tibetan, right? He needs to speak English. So at least with me or his mother or other family members, he can speak in Tibetan.
So, do you actively try to practice nonviolence in your life?
Oh yeah, certainly. I mean, like, I think, I mean, also this is quite interesting and also important because many of my non-Tibetan friends, especially in the West, would think that Tibetans are always not violent, or they are very peaceful, loving person, which in so many ways is not true. But I think having that kind of cultural kind of a buffer, or so to speak, like cultural couch, so that you can kind of lay down and use that as a way to not in a defensive manner, but in a cooperative manner, working with your own emotion can be less aggressive and less violent. I think that certainly helps. So I think for someone like me, having that kind of a cultural values and beliefs that I have inherited from people around me, really helps me to be less violent, and I constantly do have to talk to myself that most of the time it's always like not physical but mental and speech kind of a violence, and I constantly have to have a dialogue with myself. Oh, the stuff that things that I say, or things that I thought about is very violent in nature, and how I can rectify that. And that happens all the time. But I think in terms of the body violence, I think it's far less. I think there's far less chance for someone like me or my kids that they would do that.
What's the most challenging part of your job?
I think in the context of the situation that Tibetans are in, like someone like me, I mean, I always tell my friends or any non-Tibetan friends, when I talk about certain challenging situation for Tibetans, they would try to comfort me by saying, oh, you will see that everywhere. In any society, you will find such kind of issues. But I, as a Tibetan, and in this kind of a situation, I can't afford to think that way. I can't say that, oh, you can find this kind of a problem in any society and just relax and let it go. So I think that really for me the challenging part is to be a productive Tibetan and use my best ability, not only to help preserve this very kind of a unique Tibetan culture, but also to help other younger Tibetans to have that realization. And I think it's very important. And for me, really, constantly, I always have to tell myself how best I can play that role, and how best I can give back that I got. Because being a Tibetan is not always a disadvantage. Being a Tibetan, there are lots of advantages, because there are people around the world who sympathize with us and who wanted to help us. People like you all who come and wanted to know about our culture. And there are lots of other community, lots of other people who are actually much more needy and poorer than Tibetans, but why they are not getting all this interest. So in that sense, I mean, Tibetans are getting lots of support and interest from the rest of the world, and it's really for us to make sure how best to use that opportunity. And so I constantly have the feeling that how best I can do that, how best I can, as a person, as an individual, trying to make sure that these opportunities are not being wasted. And it's not only just me, but also other young Tibetans or any other Tibetans, whether they're young or elder or older, how we can have that collective realization that we just can't sit around and think that it's happening everywhere. We have a very special and unique responsibility for ourselves and for others in the world. So I think that's a really important thing.
Many argue that nonviolence worked against the British with Gandhi, but they say that nonviolence won't work with the Chinese, like being Tibetan and the whole. So what are your thoughts on that?
I'm sorry, could you ask that again? Yeah.
So a lot of people argue that nonviolence for Tibetans worked with, or for Indians worked with.
Oh, British, yeah.
British
Oh,
and,
yeah.
Sorry, and Gandhi. So, do you think nonviolence? Well, a lot of people say that it won't work for Tibetans with the Chinese.
See, I think in our situation, I mean, there could be a different way of making an argument, but I think in this particular context, certainly people might think that during the time when Gandhi and Indians were following the non-violence approach toward British, they have numbers, right? They have a lot more people, and then the situation was very different at that time. British, even though was very powerful, but not at the same level as Chinese government is right now. I mean, both militarily and economically. But I think for us, many, not only Tibetans, but also many Tibetologists, scholars and administrators, we have a collective realization that for us, and also for the Chinese people, not just for the government, for the Chinese people, non-violence is the most ideal option. Not only for the sake of being nice to each other and to create this harmonious society, But on a very practical and realistic level, that's the best option. Non-violence, in a way, can not only make things much more conducive and suitable for both the Tibetan and the Chinese people in order to revive and retrieve the harmonious or the peaceful relationship that we used to have before, but also it can earn goodwill among both the parties, both the Chinese and the Tibetans. Now, from the other context, in terms of political kind of a point of view, some people might think that the Chinese government might not care at all whether whatever we do, and so in that situation, why not engage in some kind of a violent tactics that can baffle them, or they can kind of make them worry about like whether their pros and cons of being in Tibet it's getting more and more expensive. But I think if we think from a broader perspective and a little bit more taking into consideration of other factors, acting in a violent manner can really create can lead to a devastating impact inside Tibet. The Tibetans outside the Tibet, it's a very small portion of Tibetans. We only have close to 1 million in India and everywhere around the world. But inside Tibet, we have more than 6 million Tibetans. And these are the people who actually are the real preserver and the holder of Tibetan culture. And for us to have that choice and option to decide whether we want to engage in violence or non-violence, and making a decision is a great disservice and disrespect for Tibetans inside Tibet. And so I think that's a very important thing to have that realization, because sometimes we feel like we are here in a Tibetan settlement and you see a couple of thousands of Tibetans, and for us we feel like we are the one who should make a decision, which actually is not true. So I think in that sense, it's both at the subtle and the gross level, there's a very clear indication that non-violence is the best option for us. Yeah.
The group would like to know how you think Western doctors can train themselves to use love and compassion more in their practice in Western sense.
I think, for me, I think one of the things that I have realized strongly since I moved to the US, especially based on my experiences of many of the students who would take our classes, some of the classes that I teach over there are undergrad students who potentially want to go into med school, or students, someone like you in nursing school. And one thing we all know is that in the course curriculum, like in a med school or in a nursing school, and especially it's not so bad in nursing school, because I found lots of elements related with the spiritual element, like compassion or being altruistic, in many of the nursing journal or the nursing textbook. But I think in the med school, in so many ways, there isn't really much encouragement in terms of integrating a compassion, because those things are very quickly associated with religion, and so that becomes a problem, and it kind of evaporates into when it comes to end of life care. That's a problem, because when the notion of compassion and altruism becomes completely a different section or a segment for the medical practice, then when you can't cure anyone, right? Because usually the medical framework in the West is always cure and cure and cure. Then when you get to a stage where you can't cure anyone, someone with the terminal illnesses, someone dying due to age, what they really need is not really the medicine or chemicals. They need love and compassion and empathy. And then it becomes really like these lately scholars like his name slips out of my head, but he wrote a book called Being Immortal. I can't remember his name, but he himself is a neurosurgeon, and he studied to do lots of work about the end of life care. And that's one thing, like, how we can actually incorporate more compassion and ethical practice in the course curriculum for the medical students. And that's really important. And also it creates that kind of a division between doctors and the nurses and other practitioners in the hospital setting, because you are having, on a common space, you are having different healthcare provider with a different way of assisting a patient, especially when it comes to a terminal case. So those things really, it has to come from the education itself. It will be hard to give 2 weeks of intensive training for the medical doctors to talk to be more compassionate. It really won't work. It has to be there in the curriculum. It has to be there in the syllabus. And I think in that way, suddenly it will become part of their practice, but not something that they have to be, but it will become, it will become part of their practice.
I completely agree. So before I ask the final question, I just want to thank you again.
Oh, my pleasure,
all
my
of
pleasure.
the time that you've given us, and we're looking forward to archiving this and allowing your voice to be part of the voice of Tibet, and like putting this on a platform for the rest of the world and your community to see, to just perpetuate the culture and preserve this important piece of being Tibetan.
Thank you so much. My pleasure.
So, in your opinion, what is the role of the Dalai Lama in shaping Tibetan culture in exile, and what does the future of the Dalai Lama look like in your perspective?
Well, so this is interesting, because if there's two different ways of responding to this question. But see, as a Tibetan, he's everything for us. So he's our parents, friend, role model, having someone to hold on to when you are being born, because if a family has a newborn child, they would think about His Holiness, they would get name from him. And when someone is dying, they would have his picture on the wall. And so it's really like someone like the Dalai Lama is omnipresent, so to speak, in Tibetan kind of community or Tibetan society. So that's one way of responding to that. But another way of responding to that, for someone like me as an individual, as a Tibetan refugee trying to get into a professional work and trying to contribute my work toward the society, for me, someone like Dalai Lama is a continuous, continuous element of reaffirming my belief and my hard work that I'm trying to put in. So I guess for many Tibetans who are really trying to make their mark in terms of preserving Tibetan culture and trying to preserve it for the sake of the wider population, is really Dalai Lama helps them to reaffirm their belief in themselves and to keep going. And I think in a situation where there's no Dalai Lama, I think it will be quite hard for many Tibetans to kind of keep working hard and be perseverant and have that kind of a belief in themselves to keep working in what they believe. So I think that's a really important kind of it's not the role model, or not just some kind of something that you keep up there on an altar, but someone who had worked all his life tirelessly in the face of difficulties, in the face of difficult circumstances, and still he is able to engage in lots of activities that not only shows a way for Tibetans but also for the rest of the world. And it's very rare and uncommon that someone would have that kind of influence across the society, across the world. So I think in that way it's really a kind of more than a role model. It's something that helps you to reinforce your belief in yourself. So for me it's always, I always kind of, sometimes when different things would challenge me in terms of not being able to get something done, it always helps to think about what he has done over the years and what he's doing even now when he is already in mid 80s. So I think that's a really important way of looking at the situation.
Do you think he'll return to Tibet?
Oh, the future of His Holiness. Yeah, I mean, like, again, I mean, it completely depends on himself, right? I mean, His Holiness would very often say that it depends upon Tibetans to decide whether they want the institution of Dalai Lama to keep going or not. But for almost all Tibetans, I would say for all the Tibetans, I think it's really for someone like His Holiness to decide whether he feels that, you know, he still how best he can continue the work that he has done so far, and how Tibetans are doing and behaving. Because I mean, like, in so many ways, there are many Tibetans who are not necessarily kind of complying to what he actually would ask and request from Tibetans. And the more such things happens, the less the chance that he might come back, right? So I always tell my friends, I mean, it's okay, it's fine to go to His Holiness's teachings and attend any of those religious activities, but the most important thing is to comply to what he expects from not only Tibetans but every human beings. And if we are, as a Tibetan, if we are not able to do that, maybe he might make a decision not to come back, because why he would like to when we are not complying to what he actually expects from us. So I think that's how to look at it. But I think also he had always said that, you know, the Tibetan cause and the Tibetan culture is much bigger than the Dalai Lama institution itself. And he has always emphasized that. And I think it's a high time that the Tibetans should also listen to him. It's not just like give everything, lift everything on his shoulder and let him do everything. We also have to, I guess, sit back and listen to him and kind of like, you know, introspect on stuff that he has said over the years and how we can prepare ourselves for coming future.
So what are your hopes for the future of Tibet?
I think most important thing is really to make sure that we don't let this unique cultural practice in terms of medical practices, in terms of philosophy, certain epistemology, which can be very effectively incorporated into the mainstream ways of knowing, gaining knowledge. I think those are the things which I think are very important, which is worth preserving, other than all the environmental ecosystem issue in Tibet. So I think those things, as long as those things are being preserved, those things are being made sure that those things are out there, not only for Tibetans but for the wider population, those are the most important things. I think having Tibet as a separate nation with our own political boundary and stuff, I think those are very secondary thing now in today's world. So I think the more important thing, as someone like including His Holiness, but many Tibetan scholars and practitioners have always said that the important thing is really the cultural heritage, the knowledge that we have, and the ecosystem that we have in Tibet. And those things, I think, as long as we can preserve and kind of keep them going, that's I would really, as a Tibetan refugee, I would really like to put everything into preserving those cultural heritage.
All right. Well, thank you again
You're
so
welcome.
much for everything.
You're welcome.
We
Yeah.
worked together. It was really
Yeah.
amazing. We're all very, very grateful for your time. And again, it's going to be archived and this is going to be preserved.
Oh, okay, that's wonderful. Yeah, I mean, if I said anything which doesn't make any sense, please delete them. Yeah, touch the link.
Oh, wait, no. Tick.
Touch it.